I'm Dr. Jeff Smith, author of the book, Living Pain-Free, It's Your Choice. You hear what I said? I'm the author of the book. I wrote the book on how to live a pain-free, healthy lifestyle. Today I'm going to talk to you about what's in this book in terms of thyroid, chronic fatigue, and insomnia. Now, a lot of you patients out there, if you're watching this video, you may be 1 o'clock in the morning when you're watching it because you can't sleep. You have a thyroid condition, you have an insomnia or a fatigue condition. I wrote this book to explain how the doctors up till this point in time have failed you. How have they failed you? Well, number one, they haven't looked at you as a neurological or metabolic patient. They've looked at you as a number or a condition. So let's talk about what we can do to help. How do you end your chronic thyroid fatigue or insomnia problem? What makes us different? Well, we look at our patients from a metabolic and neurologic standpoint. That means we look at brain and blood chemistry. Those two things are vital for your condition. So what does that mean exactly? Well, when we examine our patients, we leave no stone unturned. Okay? No stone unturned. There's basic tests that we run metabolically, and then there's some really advanced tests that need to be run as well. Here's how that applies. First of all, for thyroid or fatigue or insomnia, we're going to look at a thyroid panel. We're going to want a complete metabolic panel. We're going to want a lipid panel, which is fats, and we're going to want a CBC with autodifferential. Now, I know what you're thinking, and I've heard it many, many times. Heard it this morning exactly. Doctor, I've had those tests. My doctor said I'm fine. The thyroid was normal. Why are you still sick? Did you ask him that? Why am I still sick? Why do I still have fatigue or insomnia? Okay? Here's why. When you get a thyroid panel run, or when you have these normal blood tests run, you get a report. On that report says what the laboratory considers as normal. Thyroid, for example, is 0.5 to 5.0. Your lab considers that normal. Your doctor will see that and say, you're a 1.2. That's within 0.5 and 5. You're normal. There's nothing wrong with your thyroid. Well, doctor, why am I still sick? The functional normal, not the laboratory normal, the functional normal, or in other words, the optimal normal for a man or woman your particular age is 1.8 to 3.4. Much more narrow a margin. Not 0.5 to 5, 1.8 to 3.4. And if you're a 1.2, guess what? You have low thyroid. Not normal thyroid, low thyroid. So these tests, if interpreted properly, can change the life of the patient suffering. We do sensitivity testing as well on our patients that have your condition. What does that mean? Well, are you sensitive to wheat, gluten, soy, dairy, or yeast? Because if you are, a wide range of symptoms will happen to you every time you consume those products. Sensitivity can cause chronic pain or fatigue, frequent indigestion, or bloating after eating. You feel just after you eat. Okay? Frequent loose bowel movements, or the opposite of that, which is constipation. Okay? You can have ulcers or sores in your mouth. You could vomit often. All of that just because of having a sensitivity to either gluten, wheat, soy, milk, yeast, or eggs. Or maybe one of them, or maybe all of them. How do you know if you have a sensitivity to those things? Your doctor has to test you for them. And if they don't know to do that, your thyroid condition or your fatigue or your insomnia condition will be much worse because you're eating things that your body can't take. Adrenal stress index. Well, why is that test important? Well, it tells me a few things. Number one, what is the cortisol level in your brain? Now, cortisol is important for a lot of things, but one of the major things it does is if the cortisol levels are too high, it causes insomnia. It causes you to be wide awake at 3 a.m. in the morning, which may be when you're watching this video now, because you can't sleep, and dead tired at 3 p.m. in the afternoon. Cortisol in too high a level also eats away at brain tissue. Terrible. If your doctor doesn't run an ASI, adrenal stress index test, to test those adrenal glands, your adrenal glands may be not working very well. Your adrenal glands also control stress and blood pressure. If you have high blood pressure, it may be because your adrenal glands don't work. I bet your doctor didn't test you for that, did he? Autoimmune disorders. What's an autoimmune disorder? Well, that means your body's attacking itself. If your body attacks itself, it could eat away at its own brain tissue. It could eat away at its own thyroid. How do you know if you're autoimmune? Well, you get tested. Your doctor's got to test you. If he doesn't know what to test, you're in trouble. Let me give you an example of why this is important. I have patients that have come to me that have had thyroid conditions, and their doctor's giving them a 51-year-old medication called Synthroid. Ah, you're low thyroid, take the pill, right? Why do I need the pill? What's causing my thyroid to not work? Well, instead of just giving you the pill, why don't you have it tested? For example, there are 2 antibodies that we test for, TPO and TBG. If those antibodies are too high in your bloodstream, you're actually suffering from what's called Hashimotos disease. What is Hashimotos disease? It's an underactive thyroid or hypothyroid condition as a result of your own immune system attacking yourself. So your immune system attacks your thyroid gland, causing it not to produce enough hormone, so you have low thyroid. Well, your doctor just gives you extra thyroid pills. What about the cause of the problem? What about the fact that my thyroid is under attack because my body's autoimmune? Shouldn't we address that issue? You bet. That's what metabolic treatment's about. So we would want to run tests to find out why. Lymphocyte subpopulation, Th1, Th2 cytokine panels, or natural killer cell activity panels. I need to know, I need a picture of exactly what's going on in your immune system, how it's functioning, and why it's eating away at your own thyroid, causing your insomnia or fatigue or weight gain. We need to know. Because to correct that problem, you have to correct the immune system. Okay? Another thing that affects the immune system is Helicobacter pylori, or H. pylori. That's a normal bacteria we all have in our stomachs. We should have a normal amount there. If we have too high amount, it causes intestinal permeability. Now, what is intestinal permeability? Well, intestinal permeability is when your intestines literally leak out what's inside of them into your body cavity. Now, we all know what happens when your appendix bursts. Boy, that bacteria just gets everywhere. If you have intestinal permeability, you're going to suffer from what's called leaky gut syndrome. Leaky gut syndrome is when you're slowly leaking all those toxins and bacteria into your body. And do you think that's going to cause thyroid conditions or sickness or fatigue? You bet. We need to run a test to see if you're suffering from that, because if you are, it's going to vastly affect your thyroid condition and your immune system. Neurotransmitters. We have to test to see if there's proper amounts of neurotransmitters working in the brain, because if there's not, your brain cannot communicate with your thyroid or any other part of your body very well. The result of that is a non-functioning neurological system. Okay? And if you have aches or pains, it actually makes your pain levels higher just from that. Hormone panels. We need to determine if you're having low progesterone, or if you're a male, low testosterone levels. Because if you do, those symptoms like depression, fatigue, fogginess of the mind, mood swings, hot flashes, sweating attacks, weight gain, and decreased stamina can all be related to the thyroid, the insomnia, and the chronic fatigue condition. It could be the hormones causing a lot of it. If your doctor doesn't run the proper tests, you're never going to know to fix it. Inflammation. We want to test the CRP, or C-reactive protein. That tells us whether or not there's too much inflammation inside the brain tissue. If you're sensitive to food items and you continue to eat them because no one's told you differently, it's going to cause swelling in the brain. Not only is that bad for you, not only will that affect your thyroid and sleeping, but it'll kill you. It's kind of important to know that, isn't it? Glutathione. Do you have enough glutathione in your system? Well, what is glutathione? It's just the mother lode of all antioxidants. It's the one thing that will prevent you from getting cancer, for instance. And if you don't have enough of it in your bloodstream, that's a problem. How do you take glutathione if you don't have enough of it? Well, one of three ways. An enema, breathe it via a nebulizer, or use a cream, which is how we use it in our office. You rub a little cream on. It is available in pill form, and if your doctor prescribes it to you in pill form, you need to run away because your body can't absorb it in pill form. Only the three ways I told you. That covers basically all the metabolic parts of the condition for thyroid, fatigue, and insomnia, or what's the root cause of those things. Now, how do you treat them? How do you treat the thyroid? How do you treat chronic fatigue or chronic insomnia? Well, once we have the test back, and we know exactly what's causing the conditions, not the symptoms, we treat the cause. We treat our patients neurologically, meaning we treat the brain to make the thyroid function properly. Okay? We use oxygen and we use glucose or sugar. Your brain needs two things to function: fuel and activation. Fuel comes in the form of oxygen and sugars, or the food you put in your mouth. Without the proper tests, you're not going to know what to put in your mouth. Okay? Activation is the second thing your brain needs. If part of your brain isn't working properly and it's affecting your thyroid gland, the way to get that part of your brain to work is to activate it or stimulate it. Sometimes we do that with the oxygen. Sometimes we do that with laser. That's called brain-based therapy. Brain-based therapy turns on the parts of those brains that aren't functioning, that aren't working right. It treats the brain tissue and gets the brain functioning from right and left brain at the same time. Okay? Sometimes we use non-surgical spinal decompression to allow the brain to communicate properly with the rest of the body. We may use an interactive metronome, or we may use visual or auditory stimulation to fix parts of the brain. Okay? Once we've run the necessary tests, once we've determined why you have your specific condition, then we can successfully treat you via proper neurological and natural solutions. Now, before a patient comes into our office, we want to ask you 4 simple questions. Number 1, how has your chronic thyroid or chronic insomnia or chronic fatigue problem affected your job, your relationship, your work ethic, your family, your interaction with family members? How has it affected you? Number 2, what does it cost you in terms of time or sleep or money or happiness? If you're tired all the time or fatigued and you can't work, I'm sure that's costing a lot. Where do you picture yourself in 1 to 3 years if this condition isn't eliminated from your life? Well, if you're watching this video, you've probably had the condition for a number of years already. And so you know what I mean by that question. And number 4, what is it worth to you if someone could improve the condition you have? Is it worth your time? Is it worth your effort? Is it worth getting treatment from a doctor that knows what to do and how to fix you? Okay? That's what we want to know. If you can't answer those 4 questions, then we don't want to see you. Don't call us. You know, keep taking the thyroid pills that aren't helping you. Keep seeing the doctors that aren't helping you. Okay? Don't bother us if you don't want our help. We treated out of this Bentonville office last year 18,203 patients successfully. We don't have time for people that don't really want our help, that aren't willing to put in the time and effort. that aren't willing to do what we ask them. We don't want that, okay? But if you want our help, if you want to know how to end chronic fatigue, chronic insomnia, or chronic thyroid conditions from your life, you need to call us. What do you do next? Call us. 271-6992. Make an appointment. We're going to run 4 screening tests on you. Those tests will help me determine if you're a good candidate for what we do. We can't treat every patient that comes in our office. We won't accept every patient. We only accept those patients that truly want our help, that can go through the 4 screening tests and are qualified patients. People we know are going to get better. Okay? People we know are going to put in the effort it takes. Okay? Go to our website, www.thechronicpainclinic.com. www.thechronicpainclinic.com. On that website, you can listen or learn from other patients that we have successfully treated, their stories. There's little video snippets on the website. Learn about it. Listen to what they have to say. When you call our office, we're going to send you a free DVD about your condition. Watch the DVD. It's going to tell you what you need to know about how we're going to help you. It's also going to give you some ideas in terms of what questions to ask when you come in. Nobody likes to go to the doctor and not know what to ask. Watch the DVD. If you're serious and you want our help, I look forward to seeing you. Have a great day. Thanks for listening. Blessings to all.
All right, so this is Barbara Strum. Barbara was here originally for, you were here for weight loss, I think, right?
Yes.
Originally. But what we found was that you had had some cancer, some chemotherapy, and other things that caused some brain issues that kind of prevented you from losing weight, but caused some other health issues as well, right?
Yes.
Okay.